Hello, and welcome to the 4th Annual Federal Research Update webinar. My name is Dr. Heather Brown, and I'm the Director of Grant Writing and Publications at the University of Missouri-Columbia, and I am very pleased to welcome you to our event today. This webinar is sponsored by the University of Missouri-Columbia, the National Association of College and University Business Officers, and the Florida High-Tech Corridor Council, an economic development initiative of the State University System of Florida. If you have any technical issues or problems or concerns during this broadcast, please send an email to federalupdate@missouri.edu, and you can use that same email if you want to send a question that you would like our presenter to answer during our question and answer session. Again, that email address is federalupdate@missouri.edu. So our final presenter of today and of our webinar is David Shillcutt. David is a public health analyst in the Substance Abuse and Mental Health Services Administration's Office of Policy, Planning, and Innovation, where he focuses on healthcare reform and legislative affairs. His federal career began as a Presidential Management Fellow in the Policy Office of CDC's Center for Global Health. David, take it away.
Thanks. I wanted to speak with you today about SAMHSA'S strategic priorities and then a variety of our grant programs. And then I'll close by talking some about the application process, some tips that we've learned through the years about what makes for successful grant applications. And finally, leave some time for questions and answers at the end. SAMHSA has 4 different centers. The Center for Substance Abuse Prevention, the Center for Substance Abuse Treatment, the Center for Mental Health Services, and finally the Center for Behavioral Health Statistics and Quality. I'll be focusing on the first 3 of those centers since CBISC, as we call it, doesn't have its own grant programs but provides more support, technical support to grantees as well as to our other centers. I'm from the Office of Policy, Planning, and Innovation at the agency level. We also have an Office of Behavioral Health Equity that focuses on minority and special needs populations, Office of Financial Resources, Communications, and finally Management, Technology, and Operations. You can see that our budget has varied somewhat over the past few years, but we tend to be around $3.5 million. We're obviously waiting to see what's going to happen with the continuing resolution that we're expecting. We have 8 strategic initiatives. Our administrator's fond of saying that we're trying to take a variety of grant programs that have kind of operated as fireworks and turn them into a rocket ship. And so she undertook a strategic reorganization to focus on these 8 priority areas that I'll speak about briefly. The first 4 focus on behavioral health. The next 2 focus on transforming healthcare in America. And finally, excellence in operations. So the first strategic initiative focuses on primary prevention, working to build emotional health, prevent or delay the onset of or mitigate symptoms and complications from substance abuse and mental illness. The focus especially on high need or high risk populations, including youth, American Indian and Alaska Natives, and military families and veterans. The next of our strategic initiatives focuses on trauma and justice, trying to reduce the impact of violence and trauma, especially for children and families. We're working to increase the amount of screening for trauma and early interventions make early intervention and treatment a common practice. Trying to reduce the impact of trauma. We really work a lot with the justice system, both the adult criminal justice system and the juvenile justice system. Work with drug courts, work with DUI laws and programs in various states. Trying to increase eligibility and enrollment for Medicaid and other health insurance systems for criminal justice populations. And then we also work a lot, this initiative focuses on the impact of disasters. For behavioral health communities, like the recent hurricane. Our Military Families Initiative focuses on behavioral health services access as well as quality of those services for members of the military, veterans, and their families. Trying to provide community-based behavioral health care. We coordinate with TRICARE as well as the Department of Defense and the Veterans Health Administration. We also work with providers to understand the needs of these populations and how to respond to behavioral health problems within the military culture. And finally, this initiative focuses on coordinating policies and resources across the federal government, along with state, local, territorial, and tribal organizations. The Recovery Support Initiative has, one of the early goals was to develop a definition of recovery. We've divided it into 4 categories. The recovery goals are exemplified through health, overcoming and managing one's disease, as well as living in a physically and emotionally healthy way. On the home is the second category, providing a stable and safe place to live that supports recovery. The purpose, meaningful daily activities such as jobs, school, volunteering, family caretaking, creative endeavors, really focused on supporting the individual to have an independent lifestyle. And finally, focusing on the community, working to build relationships in the community that provide support so that to aid with recovery. The Health Reform Strategic Initiative is working hand in hand with our federal partners as well as states to implement healthcare reform under the Affordable Care Act. There are a few different goals. One of the priority goals there is just to ensure that behavioral health is incorporated and included in all aspects of health reform. As our systems are changing, we want to make sure that behavioral health is incorporated in meaningful ways and that we're providing the most up-to-date treatments and strategies available. We support federal, state, and tribal and territorial efforts to implement the provisions of the Affordable Care Act, particularly those related to Medicare and Medicaid, providing access to behavioral health services. Parity is another important issue under health reform. The MAPIA before the Affordable Care Act, that's the Mental Health Access and Equality Act, provides that, care providers must fund behavioral health services roughly at parity with physical health services. And then the Affordable Care Act expands that to individual plans, whereas MAPIA applied only to large group plans. The block grants will be changing. The substance abuse and mental health block grants to states under the Affordable Care Act, as treatment expands to new populations, the block grants will adapt so that they'll continue to provide safety net services for those who are not eligible for Medicare, Medicaid, or other public insurance. Also to provide access to treatments that are not covered by Medicare or Medicaid. And then finally, the block grants will be increasingly focused on evaluation of these services to make sure that we're providing the most efficient and effective services possible. The final goal of the Health Reform Strategic Initiative is to enhance the integration of behavioral health with primary care and other physical health services. This will be through programs such as health homes. We also have the primary and behavioral health care integration grants, working to find a number of ways to make sure that behavioral health is incorporated along with physical health to make sure that those services are coordinated as effectively as possible. Health information technology is a big focus at SAMHSA. Internally, we have the Center for Behavioral Health Statistics and Quality, but we also work a lot with providers and systems to provide the infrastructure to create interoperable electronic health records, to implement those, as well as to address implementation issues such as confidentiality, which is very important for behavioral health populations, and to ensure that we are using effective data standards for those records so that we can use this data to enhance the capacity for the exchange and analysis of our data to assess the quality of a care and to work to improve patient outcomes. Under this strategic initiative, we're working to provide incentives and to create tools to facilitate the adoption of health information technology, and to increase and facilitate the uptake of the use of electronic health records in behavioral health services and other healthcare settings. Under the Data Outcomes and Quality Strategic Initiative, we're working to realize an integrated data strategy and to create a national framework for quality improvement in behavioral health care, trying to create common standards for measurement and data collection to better meet stakeholder needs, working to improve the quality of SAMHSA'S program evaluations and services research, and finally to improve the quality and accessibility of surveillance outcome, performance and evaluation information for staff, stakeholders, funders, and policymakers. Our final strategic initiative is focused on public awareness and support. Unfortunately, behavioral health problems continue to be stigmatized in our society. People are uncomfortable talking about behavioral health problems, which makes it really difficult to provide the access and use of services as needed. So we're working to increase the understanding of mental health and substance use disorders so that prevention and treatment will be as effective as possible. Trying to create a cohesive SAMHSA identity and increase our media presence. Trying to provide information to the behavioral health workforce as well as to physical health providers so that they can be aware of behavioral health problems and help to ensure that patients and consumers are aware of the services that are available and that they take advantage of those as needed. And then in general to increase social inclusion and to reduce discrimination, for example, in housing initiatives, supported employment programs, and services of that nature. From here, I want to move on to talk about some of our different grant programs. I'm going to divided these up by center since that's how we handle them administratively, although as you'll recognize as we go through them, some of these will line up, will include a variety of centers and will line up with different strategic initiatives. So beginning with the Center for Mental Health Services, CMHS leads federal efforts to expand the availability and accessibility of mental health services to adults with serious mental illness, as well as children with serious emotional disturbances. CMH administers the Mental Health Services Block Grant, which is the single largest federal contribution to improving mental health service systems across the country. It was funded at about $500 million in 2012. And then CMHS also runs a variety of discretionary grant programs to help prevent and treat mental health problems. One of the larger grant programs at CMHS is the National Traumatic Stress Initiative. This has 3 levels of programs. At the national level, the first category, there's a National Center for Child Traumatic Stress. This works with SAMHSA to develop and maintain a collaborative network structure to oversee resource development and dissemination, and to coordinate national trauma education and training efforts. Category 2 grant programs are the Treatment and Service Adaptation Centers. These specialize in a single or narrow set of special issues to create resources and training that can be available nationwide for those selected issues, and to support the development, implementation, and evaluation of effective treatment and service approaches for communities and service systems around the country for those specific categories. And then finally, the Category 3 grants under the National Traumatic Stress Initiative are community treatment and service centers. These focus on service delivery at the local level generally, local or regional, working in community settings and youth service systems, collaborating with network partners on clinical issues, service approaches, policy, financing, and training issues. Public universities, public and private universities and colleges are eligible for Category 2 and 3 grants under the National Traumatic Stress Initiative. Another program of interest to our college and university partners is the Campus Suicide Prevention Grants. These are available to colleges and universities around the country. We've provided about 18 awards in 2012. These are 3-year grant programs at around $100,000 per organization. Each year, each new round of applications is targeted at a new set of colleges and universities. So if you have not been awarded a grant in the past, we encourage you to apply for the next round. We do try to spread those around. They focus on at-risk populations such as LGBT communities and American Indian and Alaska Natives, as well as military families and veterans. The purpose is to facilitate a comprehensive approach to preventing suicide in institutions of higher education. It's designed to assist colleges and universities in their efforts to reduce suicide attempts and completions, and to enhance services for students with mental and behavioral health problems such as substance abuse and depression who are at high risk for suicide attempts. At the Center for Substance Abuse Prevention, the CSAP works to improve the quality of substance abuse prevention practices in communities nationwide. It has a variety of discretionary grant programs to provide states, communities, and organizations with tools to promote protective factors and to reduce risk factors for substance abuse. The Drug-Free Communities grant program has been around for a number of years. It's meant to prevent underage substance abuse, including underage drinking, as well as prescription drug abuse and use and abuse of illicit drugs. There are 4 types of grants, new and continuing grants to create drug-free community coalitions, as well as new and continuing grants to create mentoring programs. Existing drug-free communities, we encourage them to mentor new drug-free community coalitions to adapt best practices for the implementation of these grants. They're generally either a 2 to 5 year cycle or a 7 to 10 year cycle. Mentoring grants are available for the first 2 years of the drug-free community grants. We have about 30 awards per year, somewhere between $3.5 million and $4 million in general, total over the life cycle of the grant. Schools are eligible to host drug-free communities. Most of these are high school school districts, although some of them are also provided to universities and colleges as well. Our Strategic Prevention Framework, Partnerships for Success, is one of our biggest grant programs. These are available to states, However, we encourage colleges and universities to work with states to implement this grant program. It's one of our biggest programs at $40 million. 11 to 18 awards are generally provided per year over the course of 3 years. These are targeted at reducing underage drinking as well as prescription drug use and misuse among persons aged 12 to 25. They're available to states that have completed a Strategic Prevention Framework State Incentive Grant and that are not currently receiving funding under SAMHSA'S Partnership for Success grants. They focus on high-need communities, as the drug-free communities did, including LGBT communities, American Indian and Alaska Natives, as well as military families. Under the STOP Act, SAMHSA, which is Stop the Underage, targeted at underage drinking. The purposes of this program is to prevent and reduce alcohol use among youth aged 12 to 20 in communities throughout the United States. These are provided to domestic, public, and nonprofit entities that are current or former drug-free communities. So colleges and universities can be eligible for a STOP Act grant if they've participated in our drug-free communities program. Each year, the STOP Act provides a report to Congress on the state of underage drinking in the U.S., which provides a lot of information at the state level about the level of underage drinking, as well as policy analyses of state law, state and local laws, best practices. It references a wide variety of resources that are useful to those interested in preventing underage drinking, including the community guide produced by the CDC, as well as the Institute of Medicine report on underage drinking, and just a wealth of other information. So for schools that are interested in underage drinking prevention, I really encourage you to look up the report to Congress under the STOP Act. It's a really great resource. At the Center for Substance Abuse Treatment, they have a variety of discretionary grant programs, as well as running the Substance Abuse Treatment Block Grant. It works to promote the quality and availability of community-based substance abuse treatment services for individuals and families. The Substance Abuse Block Grant is funded at about somewhere between $1.5 and $2 billion per year. It was $1.8 billion in 2012. CSAT also supports SAMHSA'S free treatment referral service to link people with community-based substance abuse services. You can find that at samhsa.gov/treatment or at 1-800-662-HELP. One grant program that's available to public and private universities through CSAT is the Targeted Capacity Expansion for Health Information Technology. This is targeted to persons in treatment. We provided just under 20 awards this year for a total of $5.6 million. The average award was $280,000 per year for 3 years. The purpose is to leverage technology to enhance and/or expand the capacity of substance abuse treatment providers to serve persons in treatment who have been underserved because of lack of access to treatment, because of transportation issues, in rural areas, for example, where there are an inadequate number of substance abuse treatment providers and/or financial constraints. So these go to state and local governments, native tribes and tribal organizations, as well as universities and colleges and faith-based organizations. The Addiction and Technology Transfer Centers, ATTCs, are public and private nonprofit entities. These assess the training and development needs of substance use disorders workforce in their area, and then they work to develop and conduct training and other technology transfer activities to make sure that service providers are using the best available technology and are aware of and using the current state of research. There's a particular emphasis on increasing knowledge and improving skills and using evidence-based and promising treatment recovery practices and promoting recovery-oriented service systems of care. These are available to state and local governments, federally recognized tribes and tribal organizations, public and private universities and colleges, as well as community and faith-based organizations. Moving on to our SAMHSA'S application process, I'm going to give you kind of an overview of how that works and then talk about some of the reasons why otherwise meritorious applications are sometimes excluded. Our grants are generally, it depends on, some of them are available for 1 or 2 years only, whereas many of them are renewed from year to year, such as the Drug-Free Communities program. RFAs are posted in fiscal years when Congress appropriates funds for the program. Given that our funding is dependent on Congress, sometimes it can be difficult for us to predict which programs will be available from year to year. So we encourage you to follow the development of the federal budget and watch for increases or cuts to various line items that are relevant to your work and your interests. As with most grant programs, many of our grants are awarded on a multiple year period. Subsequent years after the first year are distributed on an annual basis as non-competing continuation awards. You do have to reapply, but that's going to be focused on making sure that you continue to meet the eligibility standards, that implementation has been in accordance with the guidelines, etc. RFAs are posted throughout the fiscal year. We just closed out the 2012 grant awards. All of those are now posted on our website. If you would like to see who's been awarded, you can look at samhsa.gov/grants to find out which organizations were awarded and at what funding levels for each of our grant programs. From here, the new round of RFAs for 2013 grants will begin to be posted in the next few months and will be rolled out throughout the year up until September 30th of 2013. The deadlines vary, and it can, I can't speak to exactly when different grant RFAs will be posted right now, but usually it's about 30 to 60 days from the time of posting. Given that that's a relatively short turnaround, given all the work that is involved with developing a new grant application, we encourage you to sign up for newsletters, to go to our website from time to time, and to try to do as much prep work as possible so that you'll give yourself as much lead time as you can in order to develop a really strong application. The best ways to find out when our grants are available is to go to our website, samhsa.gov/grants. We have a newsletter that you can sign up for, and you can also sign up to get notifications whenever a new SAMHSA grant is posted. When we receive our applications, they're assigned to committees of 3 or more reviewers. I'll touch on this later, but we do encourage all of you to consider becoming a reviewer, since that's one of the best ways to get insight and experience about what makes for the most effective applications. We first screen them for compliance with specific application requirements. From there, eligible applications are scored in accordance with the criteria listed in the RFA. We encourage you to read those really carefully and to structure your application according to the criteria in the RFA, since that's the easiest way for the reviewers to make sure that you're eligible and to assess your application. Given the volume of applications that they review, you really want to do everything you can to take make it easy for reviewers to understand what's in your application, to know where to look for various items when they're going back through it, and to understand how it all fits together. Keep in mind as you're writing that no matter how many years that you've applied for this grant program, no matter whether you've been awarded grants for multiple years in the past, no matter how familiar we at SAMHSA are with your application, we can only consider what's actually written in the application. So we have to stress to our reviewers that they're not allowed to bring in their outside knowledge and experience of your organization and your programs. So please, some of the more experienced organizations are sometimes guilty of this, of relying on the knowledge that we, so many of us share about these ongoing programs. So please do remember to provide everything that you need on paper. The reviewers assess the quality of your response to the evaluation criteria as listed in the RFA and score it section by section. All of the expenditures in your application must be justified. However, as long as you're underneath the ceiling for the budget, budget is not a merit issue and does not have a part in determining the score of the application. For grants that are over a threshold of $150,000 or more, a second level of review is performed by that center's National Advisory Council, whether it's CSAT, CSAP, or CMHS. To ensure that fairness and the adequacy of each application is properly considered. At the end of the review process, a summary statement is created for each application and sent out to the applicant. It summarizes the weaknesses and strengths of that application. If you're not awarded, we really encourage you to look at that carefully. We may also comment on budget and other participant protection issues. A lot of our grants are targeted to special communities, and so cultural competence is really important in these applications. If you have any questions about that, about the summary statement, we encourage you to contact us. You can work through your congressional office, as a lot of applicants do, or you can contact us directly. We do field these inquiries from a number of organizations every year, and I think that in general it's very useful. So we do encourage you to take advantage of that opportunity. My email address will be listed at the end of this presentation, and I'm certainly a good point of contact for any of those questions. It's david.shillcutt@hhs.samhsa.gov, and I'll show you the spelling at the end. As I was stating, reviewers are experts in their field, and so those of you who have been working in behavioral health for a number of years, we really do encourage you to apply to be reviewers. We try to make sure that our committees represent geographic, gender, and ethnic diversity, especially with regard to the specific population targeted by the grant. We have strict conflict of interest standards, so obviously if you're serving as a reviewer, you won't be eligible to apply for the grant. However, as I was saying, it's a really good way to find out what's out there, what other applications look like, what the strengths, to understand the strengths and weaknesses of your organization as compared to other organizations that provide similar services. So it's a really valuable experience, and it's something that you can then take back to improve your grant writing processes in future years. As I was stating, we understand that the window for the turnaround of these RFAs is often short, so it's really essential to begin your planning process early. You can set up an alert to notify you of when the grants will be posted, sign up for our newsletter, but there's a lot of pre-planning that you can do before the RFA is posted to make sure that to give yourself as much time as possible. Many of these grants are renewed from year to year, so If you think you will be interested in applying for an existing grant program that will likely be renewed, you can review the current RFA, which will be posted on our website. Even if it's a new grant program, many of the requirements are kind of boilerplate. And so if you look through existing RFAs, it'll still give you a good sense of the types of things that are going to be required so that you can go ahead and start gathering the information that you need. We do have a grant application manual on our website. You can find that, again, at samhsa.gov/grants. There are also a variety of forms that you can start reviewing to figure out what data you're going to need, what kinds of licenses, certifications, and letters of support. Those letters of support, obviously, you need to be working with your partner organizations, whatever those may be, to give them enough lead time to turn it around, since ultimately the deadline is going to be your own responsibility, despite the wide variety of organizations that we understand that you're going to need to partner with. We do encourage you to develop partnerships to strengthen your application. These really help to show us that you have enough support and an effective sustainability plan to make sure that your program is effective as possible. It's a really good way to find additional information about your community, to share resources and data with those partners. It shows us that you have buy-in from those partners, and that it really enhances your credibility in the community when you have strong partnerships. Cultural competence can really be strengthened if there's a particular community in your area that you have not had as much experience working with. You can use partnerships to target a greater diversity of communities. And then to encourage community dialogue at all levels to enhance your project design as well as your service delivery. And do note, please, that some of our grants require various types of partnerships. Some pitfalls that we see from year to year. As I was saying earlier, it's really unfortunate when we're going through an application that we know is going to be a really strong application, but it's not eligible because something has gone wrong in the application writing process. Read the instructions carefully. If you don't follow instructions, we're not going to be able to review your application. It's everything from font size to margins to page numbers. Really simple stuff that every year we have some applications that get kicked out for technical problems. Make sure that you meet all of the proper eligibility requirements so that you won't be screened out before we even get into the content of the application. Cultural competence, as I've mentioned a few times already, is really important at SAMHSA, given the significance of cultural competence for delivering behavioral health services. Another important step that often gets overlooked, especially by organizations that have a lot of experience creating grant applications, is to build time in for independent review of your application. Get somebody outside your organization who's less familiar with your inner workings to read through it and give you feedback. We all, I think, can understand that when you're overly familiar, when you've been working with a program or an organization for years and years, it's easy to forget what information is common knowledge and what information is based on your own experience and is not going to be necessarily at the forefront of the reviewer's mind. So as I said, everything that we can only score the information in the application. So this is a really important way of making sure that you have everything in that application that you need to get as many points as possible. There's a wealth of information on our website, both samhsa.gov/grants as well as through each of the strategic initiative web pages. There's a technical assistance manual for grant applications. All of the formatting requirements and other technical requirements are available there. All of the forms that you're going to need. You can look up, if you're not already familiar with, your single state agency for mental health or substance abuse services. Many grant applications require you to have sign-off from that organization. Some grant programs, such as the STOP Act, just require you to notify them that you're applying for the grant. But one way or another, many of our grant programs do require you to be in communication with your single state agency, which you can look up there if you're not already familiar. We have guidelines about assessing cultural competence, and finally, guidelines for consumer and family participation. A few other things that are useful to look up. We have our NREP database, the National Registry of Effective Programs and Practices. It can be useful for you to draw from this database to inform your grant application. Programs and practices in this database are ones that have been assessed by some kind of independent organization and shown to be effective. So we encourage the use of those programs and practices. There are also a variety of data sources that you can use to look up information about your community or populations at the state and federal level. This includes the Drug Abuse Warning Network, NISDA data on drug use, and as well as a host of webinars with specific guidance for currently available grants. A lot of times we have pre-application webinars that are available for organizations that are interested in applying for specific grants. Finally, store.samhsa.gov has a variety of different print publications that are almost all free. So we encourage you to go there to look for information available for download. So with that, I'll turn it over for questions. You have my email address here if there's additional information that I didn't cover that you would like to know more about. david.shillcutt@samhsa.hhs.gov.
Thank you, David. If anyone out there who's watching the webinar has a question they'd like us to direct to David for his answer, please send that to federalupdate@missouri.edu. Again, that email address is federalupdate@missouri.edu. One question, you described a lot of different grants programs and they seem mostly focused on programmatic and public relations type of activities. Does your agency fund any sort of basic science research grants?
No, at this time SAMHSA does not fund academic research programs. So we do partner with colleges and universities for the delivery of a variety of services, disseminating best practices, that sort of thing, but we don't do, at this time we don't have any basic science research grants.
Okay, thank you. Again, if you have a question that you'd like Mr. Shillcutt to address, please send it to federalupdate@missouri.edu. How long does the review process normally take after a proposal is submitted?
It varies based on the grant. It can be anything from a few weeks to over a month.
Okay. We heard a rather sobering presentation on the sequestration situation. Will SAMHSA be affected by that if it goes into effect? And if so, can you share any of the agency's plans about how to address that if it happens?
SAMHSA has been developing a strategic plan for how to deal with the cuts that we would expect under sequestration. At this time, however, there's a lot of uncertainty about exactly how it would be implemented. So we're working closely with the department and as well as our federal partners to make sure that we're able to continue providing as many services as possible under sequestration.
Thank you. Again, if you have any questions, please send them to federalupdate@missouri.edu. Don't send them to federalupdates@missouri.edu. It'll just bounce back to you. Again, that email address is federalupdate@missouri.edu. Now, are researchers encouraged to submit drafts of their proposals before the deadline so they can get feedback, or is that not something that would be appropriate for your agency?
We don't accept draft applications before the deadline. However, there is contact information for each grant so that you can communicate directly with the project officer if you have specific questions. We also have webinars for most of our larger grant programs that will provide answers to a lot of common questions.
Okay. Now, if an institution is new to SAMHSA, what are some things that they can do to prepare a good application for your agency?
We encourage you to work with partners in your community to find out what kinds of practices have been most effective. We encourage you to learn as much as possible about the specific needs of your community so that we can be assured that you're targeting your programs effectively. We encourage you to look through previous RFAs to find out what kinds of information are going to be needed, as well as to look through our publications like the NREP database and the NSDA database to find out what kinds of needs and programs are going to be most effective in your community. In addition, as I was saying, the project officers that are identified for each RFA are going to be able to provide a lot of really specific information about that grant program that will be useful to you in making sure that your application is as strong as possible.
Thank you. Again, any last questions, please send them to federalupdate@missouri.edu. That email address again is federalupdate@missouri.edu. And if you should happen to send a question a little bit later, something comes to you in the next couple of days, please feel free to send it at any time. You can send it either to our mailbox at federalupdate@missouri.edu or send it directly to David Shillcutt, and he will get back to you. And with that, I'm going to say thank you very much. It was a pleasure to have you, and thank you for presenting.
Thank you for having me.
Everyone, just want to thank you so much for joining us for this webinar series this week. It's been quite a ride, what with Hurricane Sandy, and I'm glad that we were able to get 3 full days of filming in and get a vast majority of our presenters rescheduled so we could get their information to you. Just for those folks who, our early presentations were quite early in the morning for our friends on the West Coast. We have been taping these presentations, and in a couple of weeks they will be edited and posted. And when they are ready to go, we will make sure that everyone who's registered for the webinar receives an email address with the appropriate link to those presentations. And the slides are already up online. They're at that same website where you registered. You can go ahead and take a look at those slide presentations, and then the video presentations will join them later. And I just want to send out some thank yous to everyone who helped make this broadcast possible. First and foremost, thank you to all of our presenters. We couldn't have done this without you, obviously, and the presentations were incredibly informative, in some cases a lot of fun, and thank you again so much for agreeing to participate. Special thanks also to the people who are running the magic here, Katrina and Mike Bowles, and back at the University of Missouri, Sue Hollingsworth with video services at the Academic Support Center, Connie Coy at Moornet, Brent Jacquet, and the Florida High Tech Corridor Council for providing a significant amount of support to make sure that this event was so successful. Matt Hamill at Nakubo, you've been an incredibly gracious host, and thank you so much for letting us sit up in your conference room for the whole week. Thank you also to Mary Licklider, who recently retired as Director of Grant Writing and Publications at the University of Missouri, and who set the stage for this year's event to be so successful. Special thanks also to the entire team in the Office of Research at the University of Missouri-Columbia. I want to send a special thanks out to Mary Burrell, Chris Montgomery, Bondi Wood, Chris Bruno, Charles Reinecke and Natalie Feibisch, Jill Sappington, and the rest of the crew. We couldn't have done this without you. And to anyone that we forgot, again, thank you. And hopefully you will all join us again next year for our 5th annual Federal Update webinar. Thank you again.